It's recording. Oh, very well. So now let's give extra points for other people. So how do you say muscle aches in Arabic? You can type in the answer. Alam al-hadal.
Oh, bravo.
الهبل عضلي. عضلات.
I'm sorry.
هبل mean silly or stupid. Be careful.
Really? Oh my God. Well,
No, she said it correct. Well, she can say that.
so who said it correctly? Salma?
Salma, yes.
Okay, next. Remember? Okay, blank is commonly used to treat type 2 diabetes. Lortab, hydrochlorothiazide, levothyroxine, glucophage. Answer in the...
Glucose.
Okay, so...
Glucose.
Yep.
Oh.
There is an echo.
What? Yeah, sorry.
Okay, and somebody who can keep track of the answers. Now we're going to the next answer. So next question. So the number sign.
What?
Okay, thank you. Okay, next. Which medication is commonly used for indigestion, heartburn, and acid reflux, and to prevent stomach ulcers? Plavix, prednisone, Wellbutrin, omeprazole.
Omeprazole.
Okay, very well. Okay, and how do you say, oops, no, how do you say stomach ulcers?
Oh, we have to write?
Yep. Who said it first? Oda is correct?
I'm not.
You know, I have my Arabic keyboard, but because of the screen, I can't see the bar. Like, because you're sharing the screen, I cannot change it to Arabic.
Yeah, I know.
Oh, wow.
So unless you shrink it a little bit, then I can do that, and then, but it's okay, I guess.
Yeah.
Okay, that's what I was saying, to be able to say it, because it doesn't matter, it's just who says it first.
Sure, sure.
We can say that too?
I mean, yeah, that's why
You can say,
Let's say it without writing.
okay, you
yeah.
can say D or something. Okay.
Yeah, better.
For the answer, multiple choice, A, B, C, or D. For the translation, when I ask you to give me the translation, you gave me the translation out loud, okay? So it's more exciting. Okay. So who was right?
Sorry, Nanji, what did you say? We give translation?
I'm going
Yeah,
to
like
ask
كتبتي قرحة المعدة يعني هذه.
For that.
Yeah,
Okay.
that's what she means.
Yeah, I will ask you the question first. Just say A, B, C,
This
or D,
one,
and then...
they got it. Or they got the correct one for the answer, for the
Yes. Good for you.
And Sira got the medication.
Omeprazole.
Okay, next. Which of the following is an antibiotic? A, hydrochlorothiazide, B, ibuprofen, C, amoxicillin, D, acetaminophen.
Amoxicillin.
D.
Salma.
Amy said D first.
No, it's C.
It's amoxicillin.
Amoxicillin.
Salma said it.
Oh, Salma, okay.
Yeah, okay, I was wrong.
Okay, Salma, you get 0.3. Okay, and just an observation. Other antibiotics name are penicillin, azithromycin, ciprofloxacin. What do you think these names have in common?
They treating cold.
Cold, like the terminology?
Oh, you mean as far as like the chemical?
The spelling?
I'm sorry?
The spelling and the use, like it's an antibiotic,
Yeah.
and it ends
In
IN.
all of them. Ending in IN.
They end with IN.
Yeah.
Yeah.
They end with IN, and all of them are antibiotics, so they have that in common.
Yeah. I just did antibiotic in Arabic. It was meant to be M, the first letter, but it's a misspelling. I don't know if we're meant to do that. Mudad hayawi? I don't know, because you said we were meant to shout out the word as well, or no? It's a bit confusing here, Nanji.
Let's just shout out the Nanji because we can't write.
Yeah, so let me explain to you again. So I'm going to read the question. I'm going to read you the answers. After I'm done reading the answers, you can say A, B, C, or D only. And then if I ask you translation questions, how do you say this in this language? Then you're going to say the answer out loud. Okay? Okay. So next. Which of the following is a medication used to lower cholesterol? Hydrochlorothiazide, atorvastatin, amlodipine, lisinopril.
Atorvastatin.
So I heard that Amy said A and atorvastatin, Sira said it, right?
ما typed it in first.
So I thought we're not writing comments.
Oh, so it's B. Okay.
Yeah, so Sira got the correct answer. So everybody's clear what we're doing? Nobody's confused, right?
No, but can I ask you a question just because, remember we talked about this ATIN it's kind of more, the common thing is they have something in common. So is kind of a rule, right? When it's ATIN is for cholesterol? Remember,
the statins, yeah. So
yeah.
the statins, remember we're talking about the family of medications like antibiotics, anti-inflammatory, NSAIDs. So statins is another family and they're used for cholesterol.
What about the other one, the hydro?
The hydrochlorothiazide is an diuretic that is used for blood pressure. Yeah?
No, it's a hydrochlor. Yeah, it's a diuretic, usually to treat like heart patients when they have an edema, to get rid of the extra fluids from the body.
Yeah, to treat edema. Yeah.
They are the thiazides.
The thiazide. So that's another family of medications, right?
Yeah, that's what I want to know. Mm-hmm.
Yeah.
Okay, so no typing, just voiced answers, okay?
Okay. Wow.
Extra point, what do ER and XR mean when it's next to a medication? For example,
Extended release.
Okay, so that the point goes for Zira, right?
Can you repeat what she said because we want to learn it?
Extended release.
Extended release.
Yeah.
Oh, and the XR is the
same pretty much.
Same thing.
So here comes a question. How do you say extended release in Arabic?
مديد الانطلاق.
صح.
Which we don't like.
Yeah, I don't like الانطلاق. What is the انطلاق? It's like we have a rocket.
مديد المفعول يعني مديد المفعول.
المفعول, yeah.
مديد المفعول, not
Yeah.
Yesterday, our teacher there, Louise, was talking about this. He said some of our students, they're not with us now, but you know, don't. He said he's been telling us not to be strict about this. You have to like feel it.
Yeah.
That's funny. So مديد المفعول is
yeah.
Yeah.
So next question.
Yeah.
Okay. What is metformin used for?
to treat the glucose in the blood, sugar.
What's the name of the disease?
Diabetes.
Yeah.
Diabetes mellitus.
Yes. Okay. So I'm going to give the points to both Salma and Zira because they said it correct. What about O'Day? He's so quiet. Okay. Next.
I think he knows a lot. It's
whoa.
He does the race.
Okay. Next. What is hydrochlorothiazide used for?
It's diuretic. And in Arabic, it's hydrochlorothiazide.
Yeah.
High blood pressure too? No.
No.
No?
Okay.
I thought that high blood pressure made your body to retain more water.
Well, it can be a cause, a side effect from it, but not the actual thing.
Oh, okay. It's a symptom, but it's not like that. Oh, okay.
Yeah.
Okay. Okay, so we know hydrochlorothiazide is for edema, right?
Mm-hmm.
So this point goes for Sira? Yes.
Nanji, so there is a class of medication called chlorothiazide or just thiazides? Or there is?
I believe that.
Yeah, Sira is the expert here.
Which one? Is it chlorothiazide?
It's a thiazides. And actually, It's under the website I guys send you, drugs.com. You can find all the list of, the groups, thiazides, statins, and everything. That's a very, very helpful
Classification.
website.
Should-
The
we should-
drugs.com.
Okay.
Okay. Next. Language-specific flashcards. So again, you're going to see the word and you're going to interpret into Arabic. Sometimes you will see Arabic and interpret into English, okay? I think some of these words, some translations are not correct, but you will be able to spot that, okay?
Okay.
Okay, next.
Oh my God. Atorvastatin calcium?
Atorvastatin. Atorvastatin.
Atorvastatin.
Calcium.
It's a vastatin, but there is no V in Arabic, so.
Yeah. Atorvastatin. Calcium. Is this the right way? The right
Yeah.
thing in English?
Vastatin calcium, yeah.
Let's see. Yes.
Atorvastatin. Okay.
Okay, next. Bupropion.
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 It's the same actually.
Same one.
Yeah, this is, yeah, very, but let's see, can you tell me one use? Like, I don't know, but it's here.
Actually, bupropion.
Oh, I think I remember now.
Hold on, don't turn it.
Okay. I
Is
want.
it the pions, like that family? Is it for the stomach or something?
This is for burping.
I'm not sure. Yeah, maybe heart.
For burping.
Like I'm saying burping. For heartburn and stuff.
Let's see the answer. Commonly used as an antidepressant.
I was like, it's a pions. Okay, I should know better.
Okay.
Good
Next.
to know.
Yeah. Citalopram.
Citalopram for depression.
Yeah. Depression. Yeah, that's good.
No, hold on. Can you show it in English, please?
Yes, please.
Citalopram. The Arabic is a little wrong. Can you show it in Arabic now, please? Citalo, this is wrong. Pram.
Okay, we can go in that.
Yeah.
It should be Ram.
Ram, yeah.
That's another actually family, Pram. Citalopram, diazepam, this all family, they are mainly used for treating depression and panic attacks.
So who goes and fixes that usually?
Anybody can.
Okay.
So we need to know which, this is the medication list, I guess, right? Just make note and go back and fix it.
Yeah. It has to be under treatments and pharmacology week in some of those. Yeah. Okay, next. Antacids.
Antacids, it's for stomach, heartburn.
مضاد حموضة.
It's for the stomach.
That's like English for me.
Antacids.
Yeah.
The same name?
مضاد الحموضة.
Can we see the Arabic, please?
Yep.
Oh, Ola is here.
Oh, nice.
Hi, Ola.
Hi, Ola.
Hola. Hi, Ola.
Hi. Sorry, I'm so late, but we were out and we just came back in.
Sure.
I'm just gonna, listen to what you guys are gonna say. I'm not gonna participate. So.
Okay.
Okay, thank you for coming. So let's see.
Let's see. مضادات حموضة. So Salma said it correctly.
Okay, Salma. So many points. Okay, blood thinner.
مسيل للدم.
Yeah.
They both said it at the same time. Let's see.
Let's see.
أدوية مسيلة للدم. That's right.
Okay, next. Laxatives.
مسهلات.
Yeah, I said it last week, and it's it is like I said it last week. When you were not around, you're faster than me. Okay, المسهلات. That's right.
ولا الملينات also.
الملينات.
Okay, that's right then. Nebulizer.
بخاخات أو رذاذات.
Yes.
Yeah.
Yes.
بخاخ أو رذاذ.
بخاخ.
Correct.
Salma got it right?
Yes.
Okay, next. Pacemaker.
جهاز تنظيم
نظم القلب.
Yeah.
جهاز تنظيم ضربات القلب.
منظم القلب. Okay. منظم ضربات القلب.
So Salma got it right?
We
Yes.
all got it right.
It's okay.
I got it right too, but it's so I'm not really. I'm just observing. I'm not really participating in the competition.
Okay, but you know even though everybody got it right, is the fastest the one who said it first. So you know.
Salma.
Yeah, and I'm only, you know, let me tell you something. It's not because I'm just, oh, I just won the fastest. But, you know, when you're interpreting, you also have to think really fast, okay?
Yeah.
So that's something to consider.
Right.
Okay, next. Radiation therapy.
علاج
Oh my God. Who said it first?
I
Both
said
of us.
All of them then.
Both
I said
Amy
علاج.
and Sira? Okay, let's see the
That's
answer.
very fun.
Both are correct?
Yeah,
Yeah.
both are correct.
Okay, next.
Very funny.
Brace.
دعامة.
So, right?
Hamala.
Oh my.
Sira
Yeah.
Hamalaya.
Either one.
That isn't, guys, I want to ask you. So there are so many here. Don't you think this is too many? Don't you think
What?
that we don't
Not
need all
really,
these?
Amy.
Yeah,
No, not really,
No.
honestly, because the thing is with interpretation is that the more words you have with
Yeah.
your fingertips, the better it is. And maybe they may not be all 100% correct. They also have different people that say it in a different way.
Correct.
So I think it's a good idea to have them all because not all of them are actual hard brace. Some of them are like, you know, the sling, some of them, but it's a good idea. Personally,
yeah,
that's what I
but
feel.
the brace is specific. I mean, I had so many braces because I had injuries. The brace, it goes directly on your the parts, the
I
body
think
parts.
دعامة will be the most correct part.
Yeah.
I don't think hasira, you know, like why ribat? Because if you say ribat, this is like it has a different meaning. It's like a tie or like a.
No, it's
You
a
know what I mean?
ribat.
Yeah,
Mm.
a
But
tie or like a string or.
if you had to choose two different words for brace and sling, are you able to do it?
First one?
Yes.
Okay.
Yes.
You mean different meanings? Yes.
Yeah, because a brace and a sling these
Are
two,
different.
yeah.
Yeah, yeah.
So sling would be hamala.
Mm-hmm.
Right. That's why Amy is pointing out that the other word can mean the other sling. Okay,
So we shouldn't.
Take a note, Amy. We can go in and change this.
So da'ama maybe.
Da'ama, that's da'ama correct. But
Okay,
not
so
the
that's
other, maybe.
brace. Yeah, it's too many, and I think they confuse you because they're too many. You have to stick to.
Yeah.
It's very obvious what it is. Da'ama.
Also, just a quick tip when when you're interpreting and you pick like one word, like brace is going to be this thing for this session. It's good to stick to one term only instead
That's
of.
what I'm saying. Yeah, you don't want to confuse yourself on at that time. You start thinking, which one was it? You know.
Okay, yeah.
But I'm saying during the session, so you are consistent with the translation, even though in another session you use another term, but within the same session to refer always to the same thing. Just a tip, okay? Okay, next. Birth control, contraceptive.
تحديد
بس النحل
منع الحبل.
Sarah, I love it. I love it. You make my day.
Yeah, because they had the
Can I borrow you?
contraceptives.
Can I borrow you for like a week? Change my life.
The flowers, how the
Like
pregnancy
that.
works. Okay, Salma got it.
Okay.
Oh, yeah.
I
I
said
did that.
The first one,
Mandy-
actually. I said
Mandy, to keep you in the loop. So I said
So-
like to stop the bees.
So I would remove tanzim
yeah,
and I keep tahdid al-nasl
yeah.
because tanzim
But-
is like organized
No,
and I don't.
تنظيم أو تحديد النسل. ممكن نكتب تنظيم النسل تحديد النسل.
Yeah, but tanzim.
But it's more like نحدد مش تنظيم.
Yeah, I mean إذا ما انحمل أو لما تحديد النسل تنظيم.
You
Yeah,
can have
anyway.
this much, you can have that much. Just
Like,
But-
yeah, I want to organize my pregnancy.
Okay,
Yeah,
guys.
is birth control the same as contraceptive?
Contraceptives, yes.
Yes.
Yeah.
Okay, next flashcard. Lozenges.
حبوب مص يعني هي دواء حبوب المص
But it's, remember we talked
أو
about this,
أقراص المص.
it has to be, no, but you have to, because there are vitamins that you must do, but these are specific for the throat.
That's what I'm saying. أقراص التهاب أقراص مصة لالتهاب الحلق. But
Yeah,
we don't
it's
have
not,
that in the sheet, you know.
yeah, أقراص المص.
لالتهاب الحلق.
Oh, just أقراص المص للحلق.
للحلق, yeah.
Okay.
Yeah, because it doesn't have to be
طيب
iltihab, it's just
Nanji, can you
soothe
show
it.
us what we have?
Yep.
أقراص للمص. We can add the حلق.
أقراص المص للحلق, yeah.
Okay.
Okay, next.
Yeah, this
Mouthwash.
one.
It's a
Mouthwash. Yes,
Mouthwash. Okay.
Yeah.
Yeah.
mouthwash.
Who,
Yeah.
who got it first?
Selma,
Yeah.
I mean, Sira.
Okay. Good. Next.
Marham. Ointment. Ointment.
Okay, Amy.
I said it. Ointment. I use this a lot, that's why.
Okay, good. Splint.
حمالة.
Okay, so the sling and the splint, what is the difference?
Do you-
Remember we talked about this.
Correct. I mean, check it. You guys know what it is?
Do you want to see a photo, maybe?
Yeah, because both hamala now.
Lint.
It shouldn't be the same.
حمالة is correct then.
And what about the sling?
Sling and a splint.
I think it has rafi'a or something.
It's lint. Let's see.
جبيرة.
Oh, so هي دعامة كمان.
Do you see this girl? She has a sling and she has something in her arm.
Splint.
So she has both.
Yeah.
Then it's دعامة.
Or
Let's see
جبيرة.
what we have as a translation, if we have it
Is
correct.
it Arabic to say Jabira? Because it's
No, the
dialectal,
Jabira
as far as I know.
بيقولوا له sometimes Jabira, but I think more Jabira is like the المصبوب يعني.
Oh,
It's
you know
more-
what? I remember what you translated. You said Jabira bidun something. You said, no, you said Hamala bidun Jabira? Something like that you said before.
No.
كاست هي الجبيرة اللي بيها مادة الجبس والأخرى
Yeah.
جبيرة بدون casting.
Yeah, something like that. We discussed this before. Can you please enlighten us, Oday, if you have because I have brace, sling, and splint, so I can write it down.
Nanji, can you show us what the translation we did have? Yeah.
Yeah.
Jabira. Okay. Okay, are they you
Splint
please?
is actually open so they use a splint because it's got open sides to it, and then they put a complete cast around. So it would have open sides to allow for the swelling to go down. That's the first one that they use as a cast.
Yes, so it's not bidun Jabira. Splint is bidun Jabira.
Yeah, it kind of stabilizes the movement of your, let's say, the arm or whatever. But the Jabira, the other one, al-Masbub, is the white cast, the one that bisabu. And you
So
can
this-
break, the doctor has to really go in and cut it open. But the splints, you can take it out and you can put it back.
So I think this one is da'ama then.
But they in the Ma'ani and Reverso, they have it as Jabira. But the other one, they call him al-Masbub.
Okay, so هذه جبيرة.
Yeah.
جبيرة والثانية تكون جبيرة بمصبوبة.
Masbub, yeah.
Which was what was it in English?
Cast.
Cast. Okay, that makes sense. Okay.
Yeah.
جبيرة.
Sling is the Hammala.
Sling and hamala will brace da'ama. Okay.
They do you
Cast.
have something to add?
Yeah. هذا رجع سكت ما بعرف ليش.
عندي مو
You
مشاكل.
want to give us your input, Ade? You're muted, but yeah.
Yeah. Well, Ade is not muted anymore.
اوكي خلينا نشوف ايمي. بدنا نشوف دعامة.
Sorry, what is the Arabic translation to cast?
Cast
I have
المصبوغ.
it here. I have it. Just look at
What is
my.
it? Sira?
جبيرة مصبوبة. Yeah. جبيرة.
Okay.
Yeah.
Yusra, look at my window, my face, but instead of my face, you'll see the paper, okay?
Yeah,
Okay.
yeah, you have.
Can you show it then, please, Amy?
I'm showing it.
It doesn't appear to me.
Can you see it now?
No.
Here, look at my, like, you know,
Ah,
check.
okay. Now it's good. Okay. Okay. Thank you very much.
You're welcome.
Yeah.
Okay, let's share my screen again. So did somebody get that one right?
Yes.
No, no one.
No one?
Oh,
Okay.
no one get it.
So,
Yeah, this.
No.
So we have, let's see, cast, a splint, a sling, and what was the other one?
Brace.
Cast,
That's
brace.
it.
Brace.
Cast, a
Oh,
sling, a
brace.
sling, brace, right? Those
We
two.
have 4. Yeah, I'm gonna
Okay.
point. 1, 2, 3, 4. Okay.
Okay. Okay. So what we're going to do now is that I'm going to assign numbers to each one of you, and I'm going to read you a list of terms, and then you have to tell me those terms in Arabic, okay? So let's start first. Zira is number 1, Amy is 2, Salma is 3, and O'Day is 4. So you have to take notes to remember what I'm going to say, okay?
Oh.
Okay. I'll go in first, right?
You're first, and are you ready?
I was born ready.
No.
I was gonna say that she was born ready.
Yeah.
But I don't know how ready I'm gonna be for you.
So hold on, just to make sure that I understood right. You're going to ask us a question, and by number we answer, right? By our number.
No.
No, I'm going to read a list, like 5 medical terms, and then you're going to translate those terms in the same order
Okay.
into the other. Okay.
So I'm
Okay.
taking notes also, right?
Yep, you have to take notes.
Okay, I'm ready now.
Okay. Number 1, Sira. I'm going to read it slowly. Okay.
Okay.
Splint, saline solution, tablets, total hip replacement, transcutaneous, electrical, nerve, stimulation, TENS.
Tens. Okay, I got it. Splint is دعامة, we said. I'm sorry, جبيرة. Saline solution is
I know it.
معلق ملحي. Tablet is أقراص أو قرص. Total hip replacement will be تبديل كلي للورك. TENS will transcutaneous nerve stimulator will be this is interesting. Transcutaneous is under the skin nerve stimulator. I forgot what the stimulator is in Arabic, but
جهاز دبدبة.
شو ذبذبة؟
دبدبة.
No, it's
تحت
not.
العين.
You
No, مش
محفز,
ذبذبة.
yes, stimulator.
هو سلمى؟
محفز.
حافظ؟
حافز أو محفز يحفز.
محفز للنيرف العصب تحت الجلد. Okay, done, Nanji.
Okay, let's see. Oh no, sorry. How did she do?
محلول ملحي. I was gonna. She didn't say محلول ملحي. Did you say محلول ملحي?
I said saline solution. معلق. It's the same. معلق is correct for solution.
Okay. استبدال لكامل.
she said
لكامل. This
said
one.
كامل الورق.
Okay, this one. Arabic writing is not wrong. Total. استبدال لكامل مفصل الورق, not لمفصل الورق, right?
It should be الكامل.
الكامل لمفصل أو لكامل مفصل. أو لكامل
No,
مفصل.
الكامل لمفصل الورق.
Okay, so there is something missing. Okay, I'm gonna write it down.
Okay.
So she had one omission?
No.
She did fine. She did
fine. She
No, I
did fine.
didn't do. The writing is not correct over there.
Oh, okay.
I
So
got
is the
four.
right? Okay, good. Okay, great. So, by the way, when I read the terms, I would like you to say that in the same order, the same list. And I know you did it in the same order, Zira, but I need
Yeah, I
the,
wrote down
yeah,
notes.
the translation only, not that spleen is this thing, but only this thing, this thing, this thing, and this thing. Okay?
By the way, can
Just don't repeat the English, just say Arabic all.
Yeah, just the Arabic. Yeah.
Okay.
by the way, before you change this, please, if we say al-kamil, I'm going to have to say al-istibdal al-kamil لمفصل الورق. So we have to change two words. If I say,
Okay.
yeah,
Yeah.
right?
Let's make
Al-istibdal
it should be that way. Yeah.
لمفصل الورق. Okay.
Okay, next, number 2 is Amy.
Woohoo.
Woohoo. Okay, I'm going to read now. Okay, I will start now. Laser treatment, expectorant. Let me read that again. Laser treatment, expectorant, group and family counseling, bronchodilators, blood thinner.
Okay. العلاج بالليزر بأشعة الليزر. The second one I don't know. استشارة عائلية أو جروب استشارة فاميلية. استشارة عائلية أو مجموعة أو المجموعة. Bronco, I don't know that one. And then the last one is مخفف دم أو مسيل.
Okay, shall we see the answers now?
Yeah, I didn't do well.
Okay. So she missed 2, right?
Yes.
And what
Guys,
about
do you
the
have
rest?
anything? Do you have? I didn't
Yeah.
say. I said مسيل.
No, it's good. Musayil
No,
al-dam
it's
is okay.
accepted.
You missed expectorants and bronchodilators.
Oh wow, I know these. Why did I not say it? Bronco. Okay.
Okay. So only 2 omissions, because while we are evaluating is omissions, distortions, and let me see, what were omissions, distortions, and alterations, was it? Well, did she omit it or unregister, omission, distortions, register, and that's it. So
Okay. The first one I said it right. The second one, I didn't get it. The third one, I said استشارة جماعية والعائلة, but I hesitated. And then the fourth one, I didn't get it. The fifth one, I said it a little differently. I didn't say أدوية مسيلة الدم. I said مسيل الدم.
That's correct, though. You can say
Yeah,
that.
that's correct.
okay, so no distortions, right?
Yeah.
Okay.
The rest was.
Okay, number 3 is Salma. Salma, are you ready?
Yes, I am ready.
Okay. Implantable cardioverter, defibrillator, ICD, Lexapro, pacemaker, physical therapy, speech therapy.
I have a problem with the first one. So جهاز قابل للزراعة. What is it? ينظم ضربات القلب. I know it's half of it. Lexapro is Lexapro. جهاز لتنظيم ضربات القلب, which is pacemaker. Physical therapy هو which is علاج فيزيائي أو بدني. And then speech therapy علاج النطق والكلام or علاج النطق.
Okay, let's see the answer. And by the way, it's just the list in Arabic, okay? So you can like simulate like it's an interpretation or something.
Okay.
Okay. Next, let's see. How did she do?
I think she got 4.
I missed a lot from the first one.
So she said some of it, but not completely.
Well, the defibrillator is Mozilla Rajafen.
Yeah.
Okay, so 1 omission.
I have a question about physical therapy. Isn't it علاج طبيعي?
Yeah, it can
that's
be
akin to
بدني.
علاج طبيعي, but also you said علاج فيزيائي. Be careful with that because my grades from the college is ruined because of that. They translated علاج كتبوا فيزيائي and it was physical. So I have to go back to Iraq and do this. I mean, I have to go and contact them. Physical is not physics, not
Just
physics.
no.
It's not
Physical?
فيزيائي. Physicist is different from physical. It's like فيزيائي and this is طبيعي أو بدني.
Yeah,
It's not.
but we
It's not.
use it a lot
Is
in
it?
in
على فكرة
Lebanon. We
in
use that a lot.
Syria we
Yeah,
say علاج
yeah.
فيزيائي.
Lebanon,
Oh,
we
you
use
do?
Yes.
Yeah.
Oh my
Even
gosh.
though it's wrong, and that's why I came in and I said علاج بدني
yeah,
and then علاج فيزيائي. I said both.
and they use it all the
And they
time.
use it all the time.
Correct.
Wow.
In
You
Lebanon.
know, you know, my sister and I did physics and she did biology, and her grades is translated in Iraq. It was translated it's physics, but they said physical. So it, you know, she can't use it, and mine too. Mine was physics, but they put physical. It's the opposite. So anyway,
Can
okay.
we say علاج جسدي or does it have to bodily?
No, just but it's mostly correct. علاج طبيعي. Oh, علاج فيزيائي is used in other countries also, like the Levantine Arabic, they say it. So I don't know. I would change this بدني to or we can put two of them. علاج بدني أو علاج طبيعي. Okay.
Yeah, it's more like the standard, close to the standard.
We got four of them, Nanji.
Nanji, what's
yeah.
Lexapro?
Lexapro is the name of a medication.
Yeah, for what?
I don't remember. Maybe Sira?
Lexapro is used for, again, like, what you call it? You obviously for like epilepsy, depression, panic attacks, that sort of family.
It's the Pram family, right? Pram.
Yeah.
And also Lexapro. Oh yeah, you know Lexapro. I'm saying the Pram thing because I just search here. Is Lexapro? It's like the brand name, and the other name is
like what the hell?
It says it can treat depression and general anxiety. You're right.
Yeah.
Yeah.
Okay, so now let's do it with Odai. I want to hear Odai's voice. He's so quiet.
Yeah.
Okay, Odai, are you ready? Are you ready, Odai? I couldn't hear. Oh, okay. Okay, so Odai or Oday. How do I pronounce your name?
Oday.
Oday.
Oday. Okay. Debridement, decongestant, water pill, dialysis, diuretic. Are you interpreting?
I just wrote it down as a note. I missed just the first one. I didn't hear it well, actually.
Okay. Did you hear me okay? The rest of you?
I have maybe problems in my sound. Just 1 second. Oh, just give me a second.
Okay.
I didn't hear it as well.
You didn't hear it?
I was able to.
Just 1 second. I'll change my place, my room. Maybe I can hear it well.
Yeah, because maybe he's outside.
Okay, sorry about that. Okay, good.
Okay, but I have to tell you a different one because you are familiar with that one already.
Oh, okay.
Okay, let me see if I can find another one in here.
Our teacher is strict, no cheating.
It's not fair for others. Like you have
No,
to.
you're right. I agree.
Yeah,
That's why we didn't repeat.
Okay, let me find the Arabic vocabulary glossary. So let's see. Okay, here I have it. Are you ready? Are you ready?
Yes. Can you hear me?
Okay. Arm sling, aspirin, blood transfusion, booster shot.
arm sling وهي حمالة اليد أو الذراع، حمالة الذراع. aspirin, كلمة aspirin, the second one. And
صوتك واطئ عدي.
aspirin, can you hear me, guys?
Yes.
Yeah, it's better now.
Yes. Aspirin, that's the second one, and it's I think it's a medication, but I don't recall.
I'm sorry, can you say that again?
Aspirin. Okay, the first one is حمالة الذراع, arm sling, and the second one is I think it's a medication, aspirin. I didn't hear it well, so I guess it's a medication, but I don't have that specific Arabic. I would just say aspirin. The fourth one is blood transfusion, نقل الدم. The fourth one is boost. Boost. I just wrote it down. Just one second. محفزة لل boost shot. Sorry. I think boost shot. محفزة لل أو إبرة محفزة أو علاج boost shot. إبرة محفزة. I didn't get that last one well.
Okay, let me find let me open the glossary here in the computer so you can see the answers to the. So it was the Arabic glossary number 3. Arabic trans glossary. Oh, I found it.
So cute. You're
By the
so
way,
cute.
this is very good. I remember a lot of things now.
Oh, nice. That's nice. So here we have arm sling, aspirin, and blood transfusion, and booster shot. Do you know?
It's aspirin.
Aspirin.
Yeah, he said
أنقل الدواء أسبرين أو يعني
aspirin.
أسبرين.
ما سمعتها زين because you didn't hear.
Yeah.
I have a problem with the sound today. Yeah, so I pronounced aspirin instead of aspirin. So that's so far away.
That's the glitch when he said aspirin and it jumped. The glitch.
Yeah, so that's one mistake, aspirin. And one thing, guys, about the booster shot. I said حقنة أو إبرة محفزة.
You said it right.
Yeah, it's the same meaning.
So he got them all, or just the aspirin one?
Just the aspirin, he didn't get it.
Okay, so
But
one.
he said aspirin.
So
that's a new medication.
Aspirin. I mean,
that's cute.
Yeah.
You can talk to Pfizer. Maybe they will come up with one.
Okay, so it will be a distortion, right?
Yes, it was a distortion.
Yeah. And the previous one that I asked him first were these ones.
Okay.
This was harder, I guess.
Oh, yeah.
Because I know only 3 of them. I knew the water pill and dialysis and diuretic.
Well, diuretics is kind of same. Yeah.
But the first 2, I don't, actually, to be honest with you, I don't know those 2.
Actually, the water pill and diuretic maybe should be like one is the
low register term. Yeah.
Yeah.
But the reason why I included that one is because I wanted you to think about 2 different terms to match the register.
Because the Arabic we put 2.
Is
same, exactly the same.
Oh, okay. So here, for example, the same thing happens in another. Where was it? I think there is another one about the register blood thinner.
I think the blood thinner one, right? One is like a blood thinner and one is anticoagulant.
Anticoagulant, yeah, but it's not here.
Well, that's different though. Like
yeah,
anticoagulant, like مضاد للتخثر, And a blood thinner is usually the group of medications that's used to prevent the coagulation. It's different.
Oh yeah, they are different. Well, yeah, that's the comparison between registers. So now, do you feel like does it help you to come, like having these activities to remember the content?
Absolutely. Yes.
Of course, because I'm also doing it when it's other people's turn, and then
Yeah.
that's what I
Me
think.
too.
Quiet, quiet. though.
Oh, trying hard not to say anything.
Okay, so let's do one role play now, shall we? Okay, so let me change my mic. Look, I have two microphones. I have one good microphone and one bad microphone. And you will know which one is one when you hear. So if I accidentally like disconnect the good one and you hear me with the bad one, let me know, okay? Because it has sort of issues. Okay?
Okay.
Okay, let me see.
Are we doing the same order? But I think, yeah.
Let's do the, yeah, let's continue with the same order, but this time is going to be a role play. It's about gestational diabetes. Okay, it's a little bit long, so let's try our best, okay? Yes. Okay, so the first...
مرض السكر الحمل. Arabic.
That's for work hard?
What did you say, Sira?
The gestational diabetes is when
okay.
the pregnant woman gets diabetes.
Mm-hmm.
Yeah.
What is the Arabic translation for it? أثناء الحمل?
Yeah.
Okay, gestational diabetes. Let me give you like the brief. So a 30-year-old visits her OBGYN in her 24th week of pregnancy with symptoms of increased thirst, tiredness, and frequent urination. Okay, so just a quick question. How would you say thirst, tiredness, and frequent urination? It has no points.
You're talking to me or general? Thirst is عطش, tiredness is تعب, and frequent urination will be التبول المستمر أو المتواصل.
متكرر.
متكرر.
Okay, so Sierra 1, Amy 2, Salma 3, Oday 4. Learn your numbers. I'm going to call you by numbers. So number 1, Sierra.
Yes.
Can you tell me more about your concerns?
Okay, so tell me what I'm doing. I'm interpreting this, whatever you're saying.
Interpret what I'm saying and take notes. Okay.
So I'm sorry, Nanji, just to understand what you're doing. So you're gonna tell me one sentence and then I'm interpreting, or you're keep going on? What's happening?
This is a role play, like the ones that you do when you're in I'm going to read a few sentences, you're going to interpret. It's a conversation. And every time I read, somebody's going to interpret when I call your name.
Okay, so when you say one, I'm gonna go ahead and interpret. Okay, so I'm gonna interpret whatever you told me. So أخبرني هل لديك أي شو اسمه concerns? Oh my God.
Can we help her? Can we help her? Can the number
concerns?
Yeah, this is what we can do, because to give feedback, like you have to feel like you're in the real situation. So Salma will this is what you will do, Salma. You will interpret everything that you know, and if you do not know a term, you say it in English. And then the others, once you finish interpreting, they cannot stop you in the middle of, you cannot say like, oh, I don't know how to say this. You just try your best. And at the end, we're going to give feedback and tell you everything. Okay.
I'm gonna do it again. So أخبرني هل لديك أي مخاوف؟
Okay, so what do you think?
أو ما هي مخاوفك؟
Okay, so this is another thing. When you're interpreting, you want to give, like, you don't try to correct yourself. You just interpret.
Yes.
Yeah, because
I suck.
All the time. Yeah.
Imagine that you only have one opportunity, okay? In real life, you might be correct, but let's do it for like one opportunity and do it your best, okay?
Okay, tamam.
Okay, thank you. So what do you think, girls?
Nancy is correct, but he's speaking to a lady because she's the one that's pregnant. And
I'm sorry. It's start being Armenian.
Yeah. I know, it's a lot, Sira. It's a lot.
I
Well,
always
I mean,
don't pay attention
nowadays,
to who.
nowadays
It's
everybody.
possible.
No,
And
no,
today,
actually,
actually,
it's not a question. It's not a question, actually. So I'm going to say the sentence again. أخبريني ما هو what is your concerns؟ ما هي مخاوفك؟
Okay, did she miss anything? Any distortion, omissions, changes?
Can you say it in English again? Because we kind of like took a long time, so we don't.
Okay. Can you tell me more about your concerns?
Yeah,
She missed a little bit.
I missed the can and more.
Yeah.
Okay. But she got the meaning right?
Yeah.
yes,
She
she
did.
did.
Okay. So number 2, Amy. I'm feeling this incredible thirst. No matter how much I drink, I still have this unsatisfied feeling.
أنا أشعر بعطش شديد أو مريع. No matter. I don't know that one in Arabic. I cannot remember.
Remember what we said? That we would
Yeah.
just interpret and then
No matter ما أفعل لا أشعر في الاقتناع, not اقتناع, satisfaction.
Okay, so
I can't remember. Yeah.
okay, so how did she do?
No good.
I can see comments in the chat.
Actually, I'm right. Saying that, I know it.
I would say مهما فعلت لا
مهما
مهما فعلت لا أشعر مش بشبعة بس لا أشعر بأنني غير عطشانة مثلا. I'm on my feet. I'm doing it really.
اقتناع. Yeah, I said اقتناع because satisfaction. I didn't know. I didn't get it. Yeah. What is satisfaction in Arabic?
بأني ارتويت. How about ارتويت? Would that be right?
ارتويت. Yeah, nice one.
Thank you.
So, okay. Good.
How many omissions? How many additions?
2.
Oh, two omissions?
I think the English, I couldn't say it in Arabic.
Okay.
What do you guys think? أنا أشعر بعطش شديد. Oh, he wrote it. This is what I said. Or they wrote it. I said أنا أشعر بعطش شديد ما أفعل لا أشعر باقتناع. Can you say it in English so they can see what I did, please?
Okay. Yep.
But there was a way too longer in English sentence, like she said a lot.
Well, if she said in English, then you'll know because O'Day wrote what I said, so you'll compare and see what.
Yeah, that's why I'm listening.
So please say it in English so they know.
Okay. I'm feeling this incredible thirst. No matter how much I drink, I still have this unsatisfied feeling.
Wow, I missed a lot.
Middle was completely missed, yeah.
I missed a lot.
So إنني أشعر بعطش شديد أو رهيب. مهما أفعل لا أشعر بأنني أرتوي
مرتوي.
مهما أو بغض النظر عن الكمية التي أشربها لا أشعر بارتواء. بارتواء. It's a long one, yeah.
Yeah, it's long.
So
What
she was able to say the first one, I'm feeling this incredible thirst. And then she was trying to do the last one. So the middle one was like omitted, but that's because there's a lot. I mean, it's not.
Okay. So
what about
number
the last one, dissatisfaction?
Unsatisfied feeling?
Very good all day.
Okay. Number 3, Salma. I'm urinating a lot more, and I'm not sure if this has anything to do with the increased drinking. I'm feeling tired.
إنني أتبول بكثرة ولست متأكدة إذا هذا له دعوة مع زيادة في الشرب. كما أنني أشعر بإرهاق شديد.
Yeah. Very good.
Okay, no omissions, no additions, no distortions. And what about the register?
I think she got them.
She got them all right?
Mm-hmm.
Okay.
On the drinking.
Just I will say the related da'wah. Maybe, you know,
Yeah,
we
this
can
is
متعلق ب
متعلقا بقسم الشرب. Yeah, just one word.
this is low register, so you change it, right?
Oh,
Yeah.
she changed the register?
No, she just did هذا له دعوة شوي. It feels like it's a little low register, but everything.
The related word she used different. Like she could, you know, that's it.
Instead
Just
of
the
saying
one
this is
word.
related to, I said this has something to, this has something to do with my increased drinking, instead of this is related.
Related, yeah. Yeah.
And it's got to do with my increased drinking. That's what I said.
You know, I was watching, this is just a parenthesis. I just became a member of NICHC, you know, the National Interpreting in Healthcare Council or something like that. They also created the Code of Ethics, and I just listened to one of their webinars. And it was super interesting because sometimes when we interpret something, every time the patient says something, they say something as a complaint, as, okay, I'm feeling worse, I'm feeling better. This is distress, something emotional, like I'm feeling emotionally like anxious or something. And also those are the opportunities to show empathy with the provider. And those are the opportunities that you as an interpreter want like to grasp, like to show the same style, the same tone, the same register, so they can show that, so it can become an empathic opportunity. Okay, so the changing the register, like related or something to do with it, in this case it's not such a big deal, but if you become used to, you know, getting those little things right, you will do them with the things that are more important eventually. Okay.
By the way, so are you going to attend the 16th of October then? Because I'm registered and Sira registered too.
Yeah.
Are you going to attend that one?
Yeah, we're going to see each other there.
It's about harassment, sexual
It's
harassment.
rape, sexual harassment, and very important for women.
Yeah,
It's hard to see these topics actually. I never seen all these Zooms.
Yeah. So I'm going to be there, and also we can have like a discussion after.
Yes.
That would be nice, right?
Okay.
Okay. So
And maybe you can join our meeting when we do the ethics meeting. We have a meeting that we're gonna do. I was thinking about you. We planned one on Friday, and we want to do scenarios, or like, you know, just to practice and, you know, increase our information about ethics. Like we do scenarios. I was going to ask you if you have scenarios, and then we decide what to do in this case.
Like what should the interpreter do?
Yeah, so I was, you know, like I was going to do my Zoom, but I was thinking that maybe you want to join because, you know.
Yeah. When is it going to be?
It's Friday. Are you guys okay with that? Friday, 12 o'clock?
Mm-hmm. Yes.
Okay. Yeah, we could do that. Yeah.
So we'll keep communicating about this, but just now that we talked about this, so.
Yeah, very interesting. Oh, very interesting. Okay, so the next one. So this one is for O'Day, right?
Yeah.
Okay. Let me review your fasting blood glucose test. The normal range for glucose is 126 or under, and I see that your glucose level is 200.
Wow, that's a lot.
Yeah.
دعيني أرى حكتبها أيضا. دعيني أرى مستوى الجلوكوز لا أيام okay. مستوى sorry, I'm talking with myself too. I wrote the notes. مستوى أيام سكر الدم
By the way, when you're interpreting in real life, I hope that you're not doing what you're doing like now, like talking to yourself and being like, oh, I don't know. I hope that you don't do that.
No. I was typing almost. I'm like doing two things at the same time. So I'm not gonna type. Okay.
Yeah.
نرى مستوى صيامك أو مستوى السكر في الدم، حيث هنا تشير الأرقام أنه 126 الرقم الصحيح أو أقل، وهنا الرقم الذي يشير إلى السكر في الدم لديك هو 200.
عودي كتبتها كلها هذه لو بس نوتس؟ لأنه ما سمعنا كل صوتك.
ما سمعتكم؟
No, يعني شوية واطئ فمو كله سمعنا. I don't know. What do you guys think?
Yeah, it's far away.
Oh, okay.
Yeah, we couldn't hear well.
Okay. دعيني أرى مستوى السكر في صيامك، وهنا مستوى الجلوكوز أو مستوى سكر الدم الجلوكوز الطبيعي في الدم يشير إلى 126، ولكن الأرقام لدينا هي 200، يعني الرقم مالتها من الجلوكوز.
Okay, can I try it, Nanji? So.
Okay, so let me read it again so we can.
Yes, please.
No, I got it.
No,
Yeah.
but
Okay,
we confirm before you say.
Yeah.
Tamam.
Okay, so let's repeat. Let me review your fasting blood glucose test. The normal range for glucose is 126 or under, and I see that your glucose level is 200.
Okay. I see you just missed test. Are they? مستوى. And then.
Okay, so I'm gonna say it. دعيني أرى مستوى معدل السكر الصائم لديك. المدى أو المدى الطبيعي هو 126 أو أقل. أنا أرى أن مستوى السكر في الدم عندك هو 200.
Okay, you said الصائم. I don't.
Yes.
He said مستوى صيام glucose. I don't.
هو معدل السكر الصائم.
I think his rendition is much better. Same glucose.
Yeah, الصائم يعني هو الصائم غير الشخص. Like glucose cannot be صائم, can it?
No, it's معدل السكر الصائم. يعني when you're fasting, it's the the level of the sugar in your blood. So it's not like someone is. It's not like we're talking about glucose.
It has to be rephrased in Arabic. معدل.
That's the medical terminology, Anyway,
sounds right.
So I think what he missed is like the normal range is being under 126. And also he missed, I see that your glucose level is,
Okay, so he missed the most important information.
But the first part, he said it correctly. And yeah.
Okay, so next one, so we had 2 omissions, right?
Mm-hmm.
Okay, so the next one is Sira again. Okay.
Okay.
You're going to do 2 sentences, but they are too short. Number 1, Sira. Do you have anyone in your family with a history of gestational diabetes?
هل لديك أي فرد بعائلتك مع داء السكري أثناء الحمل؟
Did she miss anything?
مصاب أو because you said you know like can you say it Nanji again please?
Okay. Do you have anyone in your family with a history of gestational diabetes?
له تاريخ Oh, it's correct,
I
yeah?
think the way correct.
No, it's correct, Nanji. What
It's
she
correct, yeah, it's correct.
said, Sira
Okay.
said correct. Yeah, she didn't miss anything.
No, she didn't.
Good. Number 1, again, Sira.
Yes.
Gestational diabetes, is that a bad disease?
السكري أثناء الحمل هل هو مرض سيء؟
Did she do right?
Yeah,
She did. So what is it in English?
Oh, okay.
Gestational diabetes, is that a bad disease?
So هو okay. So بالعربي نسميه يعني what do you say? نسميه سكري.
سكري أثناء الحمل.
Yeah, you don't have to say أثناء Sira. You can just say سكري الحمل.
سكري الحمل. Okay.
سكري الحمل. بس أثناء الحمل is not incorrect either. But just, you know, سكري الحمل is the...
Okay. Yeah, because a woman can get it while she's pregnant.
Right.
Okay. 2, Amy.
Okay.
Okay. Are you ready, Amy?
Yes.
Okay. It is not a bad disease, but if you have developed this condition, you will have to be supervised very carefully.
هو ليس مرض سيء ولكن إذا developed إذا أصبح لديك developed. What did we say for developed? إذا تطور لديك هذا فيجب أن Okay, I messed up again because I lost my train of thoughts because I was thinking of one word.
تخضعي لمراقبة. يجب
Yeah, but I do this a lot because I think of one word and then I lose my train of thought.
If you develop this condition, you will get supervised closely, I guess, she said.
Yeah.
Carefully.
Yeah,
Should I repeat?
Yeah, I mean, she did it. Selma did it right. تخضع للمراقبة. This is important.
Okay, I'm going to repeat the English so we can know if she did good or bad, okay? Okay, so it is not a bad disease, but if you have developed this condition, you will have to be supervised very carefully.
Yeah, very carefully عن كثب أو
But you guys, you're missing if you develop this condition. Before we jump to the last part.
وإذا تطورت لك هذه الحالة فيجب أن تخضعي لمراقبة عن كثب مثلا. That's what I would say.
دقيقة.
يعني.
Okay, so now how many omissions, additions, distortions, and registers?
I did only one thing. It's because O'Day wrote what I said. Thank you.
So do we say تحت مراقبة أصح in the medical terminology, or we can say تحت إشراف?
I think supervisor will be إشراف أضبط.
I like that too.
إشراف دقيق.
So could you tell me what Amy, what did she get right so I can like
just the first sentence, I guess. Right, Amy?
It was one.
No, she did bad. I did bad, okay?
Okay.
No, that's not the point.
Okay, so can somebody type in English what she said so I can compare with the script in English?
She just translated that it's not a bad disease, I believe, right?
She didn't say anything else?
No.
Oh, okay, so oh my God. So 4 omissions of keywords.
Can you tell us, Nanji, what are the rubrics in this conversation?
I'm sorry?
Can you tell us what, I'm sorry, Salma.
No, I'm just gonna say, yeah. I'm so worried about this patient. She'll be dead before we're done.
I hope that's not real life.
We're fighting over the right words and she's sitting there with gestational diabetes.
Well, I, for one, I'm not going to go and work with her because I say, look, I'm a beginner. I need another interpreter.
Yeah. But does this condition really kill you?
I'm sorry?
Like, does this condition really kill you?
Gestational diabetes? Well, just
Yeah.
I read that gestational diabetes can give you, I think,
I
oh,
think
no,
the baby can get blind or something if it's not controlled.
Yeah.
It can affect the baby. They
Yeah.
give them medication. It needs to be supervised because as a result of the gestational diabetes, they can also get high blood pressure, which is very, during pregnancy. It's something to watch. Nancy, I have a question, please.
Yep.
You said 4 important words. Can you please tell us what the rubrics are in these sentences so we pay attention to it too?
Okay, so it's not a bad disease. Bad disease is an important word. But if you have developed this condition, develop condition is an important word.
Okay.
You will have to be supervised very carefully. Very carefully supervised is another
Okay.
word.
Thank you.
Okay. And also you can kind of infer what is the important word by the message, right?
Right. No, because why I'm asking you, because, they have those the bolded words. So we know, to pay attention to this.
Yeah, I'm going to, you know what I'm going to do? I will ask you a question about the keywords after.
Okay.
Okay, so let's do the next sentence. So, Salma, number 3.
Yeah, okay.
You will have to visit the nutritionist and the diabetologist for consults and again for some additional follow-up appointments.
Okay. عليك أن تزوري أخصائية الغذاء وأخصائي مرض السكري لتتشاوري معهم للتشاور و معاينات إضافية تتبعية. I messed up on the last part.
Okay, so I'm going to read again and then I'm going to, can somebody, before we have the discussion so we don't forget, type in what Salma said in English so I can compare to the English script. And while that person is doing that, I'm going to read the English version again. So here it is. You will have to visit the nutritionist and the diabetologist for consults and again for some additional follow-up appointments. So now, what are the key words in here?
And again, after and again, she missed the
I missed the and
she
again.
didn't do and again because Uday wrote it in Arabic, what she said. So.
Okay.
But everything else she said, she did it right. I think.
Do we say
استشارة أو متشاور؟
أخصائي الغذاء أو التغذية؟
What did you say again?
Do we say أخصائي التغذية أو الغذاء؟
تغذية.
Nutritionist.
تغذية.
Yeah.
تغذية.
Okay, so the key words in here were visit the nutritionist, diabetologist, and consults and follow-up appointments. So did she said visit the nutritionist, diabetologist for consults and follow-up appointments?
She said only follow-up appointments. She didn't say. She said half of it. Well, kind of, yeah.
So it's sort
معاينة.
of, so it's like a distortion. Did it alter the meaning?
No.
It's more of an omission. It's more of an omission.
It's an omission. Okay.
Yeah, it's more of an omission.
Okay, so Salma has one omission only. Okay, so next, Oday. Are you ready? Oday?
You hear me?
Oh yeah, I can hear now. Okay.
شوية صوت yeah.
Okay. Gestational diabetes happens to women who do not already have diabetes. Around the 24th week, we sometimes see high blood glucose levels.
داء حمل داء السكري أثناء الحمل يحدث للنساء التي ليس لديهن سكري مسبق سابقا، وفي الأسبوع الثاني 24 يرتفع مستوى السكر في الدم. I'm not sure about the last one. Just the last one after the 24th.
After what you said, the 24th week.
Yeah, didn't catch.
That is correct. Yeah.
Okay,
So are they still to do it or?
Yeah, I will redo it. I mean, I will.
Can you repeat it, the last one after 24 weeks, so he can?
we sometimes see high blood glucose levels.
بعد الأسبوع الثاني 24 سوف تلاحظين هنالك ارتفاع في مستوى السكر في الدم.
عدي,
Yeah.
maybe you want to hear it again because it wasn't the correct interpretation.
Yeah, the last one you didn't say. You said, we sometimes see, she said.
Okay, so he means the sometimes see, and he did say high blood glucose levels.
Yeah.
Okay, so he had one omission, and did he say always or never, or he just didn't say sometimes at all, and that's it?
No, he didn't say sometimes.
Okay, and
sometimes.
But it's a long sentence.
Yeah,
well,
but you know this sentence I have splitted the sentence, or I have split the sentence in several segments, but it's actually a very long paragraph, and they actually talk like that. So
wow.
Yeah, they talk.
So what's the maximum, Angie? They can talk like 5 sentences, like a provider, the maximum, how much they will say. But you can tell them to.
Yeah, but I think the maximum is it just depends on the provider, how much they feel like talking. And also another thing that happens is that most of the times when they talk for a long time, it's kind of the same idea. Okay, they don't include all these new ideas. They just talk about one idea and then they say several things about that idea. So it's easier because they're talking about the same thing. So
okay.
Let's.
As doctors.
Very well. So one omission. Zira, number 1.
Okay.
The hormones that pregnant women normally produce to help the baby grow at times, and we do not understand why, block the production of the insulin.
Just great. Okay, give me 1 second. Okay, it's not an easy one. So الهرمونات التي تنتجها الامرأة الحامل ولا نفهم لماذا I don't know, the block production of insulin تمنع إصدار الإنسولين. Did I miss something? I feel like it's a disconnect between the sentence.
Yeah, this is an awkward sentence because they
produce something.
Yeah, it is the hormones, and the meaning is this: the hormones that pregnant women normally produce block the production of the insulin, but he puts something in the middle.
So I guess I missed the normally produced, and we don't understand why it blocks production of insulin. The rest I got it. So I missed normally.
Okay. Yes, and O'Day wrote it here so you can see what you said, Sira.
I think for the production of insulin, it's better to say إفراز الأنسولين than إصدار الأنسولين.
تنتج المرأة الحامل تصدر no.
إفراز is much better.
And we don't ولا نفهم لماذا what did I say for that? تمنع إنتاج الأنسولين.
You said هرمونات التي تنتجها المرأة الحامل ولا نفهم لماذا تم إصدار الأنسولين.
I know exactly what I said. I mean, it can be just writing down. It doesn't mean that I said that, you know. I know. Thank you for pointing that out.
إنتاج
I'm
الأنسولين.
not a kid. I can see, I know what I'm saying. Thank you. But, so yes, Salma, what's your input?
لا, she said, all she missed was normally.
Yes, exactly.
إنتاج الأنسولين مش
I
إصدار.
did say, yeah.
No, she said إنتاج الأنسولين.
Yeah. So,
So
sorry, I don't
all
sound
of
rude, but I don't like
normally.
I'm being treated like a kid, you know. I know what exactly I said.
Okay,
I
I'm sorry.
appreciate your comment. No problem.
Okay. So, Sira, what do you think you missed?
Normally.
Normally? Okay. And did you
Yes.
say block the production? You said it in English.
Yes, of insulin. No, I mean, I repeat in English, then said it. Maybe that's my mistake. I shouldn't do that when I'm interpreting for someone. But I said it in Arabic later.
Okay. So one omission of normally?
Yes, that's correct. But everything else she got word for word. It was all correct. So the
Okay.
meaning was definitely there. The only one is normally.
Okay. So number 2, Amy, I'm going to read 2 sentences, but I'm going to split it. Okay. So this can sometimes lead to the birth of an abnormally large baby.
هذا أحيانا يؤدي إلى إلى طفل كبير طفل كبير غير طبيعي.
Okay, so I'm going to read again. This can sometimes lead to the birth of an abnormally large baby.
I missed something very important. I was questioning this. It's the birth. It's very important.
Yeah. So one omission. Okay.
It's an important one, right?
Yeah, it is. Sometimes lead birth in abnormally large baby. The words that are sometimes, never, every once in a while.
Can you guys have your input?
Yeah.
I would like to hear another time.
Yes.
You would like to what?
Maybe هذا قد يؤدي إلى ولادة طفل متضخم الحجم أو ذو حجم متضخم غير طبيعي. I don't know, what would you guys say?
Yeah.
What did you say about متضخم?
Yeah. ولادة طفل متضخم.
متضخم, like an abnormally large child, غير طبيعي.
I like what Salma said.
متضخم
ضخم الحجم.
ضخم الحجم غير طبيعي.
غير طبيعي. Yeah. عودي.
أنا أتفق وياكم صح. هذا أحيانا يؤدي إلى ولادة طفل متضخم غير طبيعي أحسن من كبير.
أو ضخم الحجم، ضخم في الحجم غير طبيعي.
Yeah. لأنه متضخم يعني ده يكبر بس ضخم.
غير طبيعي.
Okay, so just one omission, the birth, right?
Well,
yeah, we did.
Could have been better, but
could have been better. But you know, you delivered a message at least, right?
Yeah, I missed the birth. That's important. Yes.
Okay, so Salma, number 3. Oh wait, I was going to read 2 for Amy because that one was too short. Okay, so this one is for Amy. Perhaps this is what happened to my mother when she was pregnant with my brother.
من المحتمل هذا الذي حدث مع والدتي عندما ولدت أخي.
Good.
I think there is another.
Can we say أنجبت? ولا it's true to say ولدت.
Oh, أنجبت is probably better.
أنجبت, yeah. Better registered.
Perhaps. Okay, so now
ربما, perhaps ربما is better.
Yeah.
So what you are changing is the register or something about the syntax?
Yeah, my register is a little bit on the, I mean, it gave the meaning, but it's the register is not the high register. It's kind of like
cleaning up. Yeah, we're cleaning up the sentence. That's all.
it's
man.
like a liberal register.
Yeah.
Okay, so for which word? For brother?
Perhaps.
Oh, perhaps.
And
And gave birth.
Give birth.
Give birth. Okay. All right. So Salma.
Mhm.
I guess he grew too big inside the womb and she had to be medically supervised very closely.
She gets the same.
أعتقد أنه نما ليصبح ضخما أو كبيرا داخل الرحم وأدى ذلك إلى مراقبتها طبيا بشكل دقيق.
So should I read it again so you can compare?
Yeah. Yes.
Okay. I guess he grew too big inside the womb and she had to be medically supervised very closely.
Yeah, she did good.
Yeah, she did good. I think, I'm not sure, you guys can correct me. The part where it says she had to be supervised. Salma, تتذكري كيف قلتيها؟
I don't remember, but I don't think I emphasized that. I just
It
said,
says
yeah.
يتم مراقبتها بشكل دقيق. That's correct. Very closely.
وألزم ذلك probably better, closer. وألزم ذلك مراقبتها بشكل دقيق.
Yeah.
Okay, let's do the very last one for O'Day. Now, this is making more sense. Your mother must have had the same condition. I'm not worried, but we need to watch this pregnancy. You are not overweight, and your last baby was only 7 pounds at birth.
Wow.
Super long to close big.
This is the interpreter, please. Can you please repeat for me the whole thing?
Okay, sure. And you know, something about the whole thing, if I ask a repetition, I will say, this is the interpreter, the sentences, this is the interpreter. Could you repeat, please, so I can be more accurate or something like that? Not the whole thing, because, you know, I feel the whole thing is a little bit informal. I don't know how you feel about it.
Mhm.
You know, could you repeat so I can be more accurate? Yeah.
Nanji, can you ask them to, I don't know, to split them into two segments, or that's not okay?
What I will say is something like this. This is the interpreter. To be able to preserve accuracy, I need you to speak in shorter sentences. Or to be able to interpret everything that you say as you say it, I need you to speak in shorter sentences. And they will usually speak in shorter sentences. But then after a few phrases, they will go back and do the same thing, and you just repeat them. It's going to be super frustrating for both, but you know, just they have to learn. Right?
Thank you very much.
Okay, so I'm going to repeat for O'Day, right? So O'Day, could you ask me to repeat in a very nice way?
Here is the interpreter, please. Can you please repeat the whole sentence, because I missed the whole conversation.
I think we are not used to it because it's too formal.
Yeah, but the thing is, when you say, you know, it looks like I'm nitpicking, but you know, these things count because the way that you treat the client, the customer service part of interpreting says a lot. So when you say, can you repeat the whole sentence? It's like I will think you weren't listening to me. Are you not listening to what I'm saying? So it will be, you could say like, could you repeat the whole sentences, or could you say one sentence at a time, something like that. Okay, but okay, just a tip. I'm going to repeat. Now this is making more sense. Your mother must your mother must have had the same condition. I'm not too worried, but we need to watch this pregnancy. You are not overweight, and your last baby was only 7 pounds at birth.
هذا حاليا no, that makes هذا حاليا يكون واقعيا جدا. لا no. Just sorry, I will just rephrase it again. It's the whole thing. Now that's making more sense. هذا هذا الشيء يجعله واقعيا أكثر. أمك لديها نفس الشيء سابقا، ولست قلقا عن داء سكر الحمل، لأن الطفل كان وزنه عند الولادة 7 باونات 7 lbs.
Okay. So did he miss something?
Yeah, I just said like now that making more sense. I didn't interpret it well, so I wish from the team that will rephrase for me the now that's making more sense.
Okay, so that,
I don't know.
it was a distortion, omission, addition, or something about the register.
Oday, can you just, I'm sorry, I was trying to think of making more sense. Could you just repeat like the last part? This is the interpreter speaking. I'm kidding. But can you just say what you said, that like after it's making, I'm not worried? وبعدين شو قلت عدي? What did you say?
قلت لست قلقا حيال داء السكري أثناء الحمل، لأن طفلك عند الولادة كان وزنه 7 باونات.
Did you hear that she said that you're not overweight, and no, we don't need to worry?
No, I didn't write that.
Okay, I was just wondering. Okay, so there was that omission of you are not overweight, that's why he doesn't need to worry, and that you had a small baby. يعني الباوند بالانجليزي بالعربي شو اسمه؟ رطل is أو أرطال. Yeah, رطل is singular, أرطال is plural. I don't know what anybody feels، بس هذا يجعل الأمر أكثر منطقيا مثلا، أو أكثر وضوحا. We can also say in this case.
Yeah, it's now this is making more sense.
هو sense is منطق، بس I think what he means that it's shedding more light. I would say أو الآن أكثر مثلا، أو الآن الأمر أصبح منطقي بشكل أكثر مثلا.
أو واضح. Yeah.
أكثر وضوح.
It's more وضوح than منطقي, right?
But I like what he did with تقلق حيلة. It's
أكثر وضوحا. Yeah.
إيه، لأن هاي الجملة بالبداية that making more sense وقفتني.
إيه حسيت عدي. It stopped all of us على فكرة. We would all be the same.
Yeah.
Very well. So we are going to
to just say it again so that we can at least have like a full rendition. I'm sorry to do this. This way, at least it's not stuck in anybody's mind.
Okay. Yes, I will.
Yeah.
So now this is making more sense. Your mother must have had the same condition. I'm not too worried, but we need to watch this pregnancy. You are not overweight, and your last baby was only 7 pounds at birth.
Okay. So الآن إن الأمر بدأ واضحا أكثر، أو أصبح واضحا أكثر. إن أمك كان لديها نفس الأعراض وأنا لست قلقا مثل ما قلت عدي حيال ذلك لأنك what was it? But something during I can't even read my notes. This is ridiculous. I'm just so tired.
Yeah.
Anybody?
Sarah.
والله أنا you guys lost me because I was not.
أنا لست قلقا ذلك
الحمل
هذا الحمل ولست ولا تعانين من السمنة كما أن كما أن ولدك كان يزن 7 أرطال الولد الأخير كان يزن 7 أرطال فقط. Okay. Right? Okay.
It was not an easy.
No,
because of the first one. Now this is making more sense شوية. So how do you say it? Like if we يعني إذا نكتبها كسنتنس لأن هاي جوز تجي مرة ثانية. Now this is making more sense. How do you say it? And sometimes I do that. I write notes of.
Well, to make sense أصبح ذلك منطقيا بس in this case أصبح الآن
أو يبدو الأمر منطقيا أكثر منطق.
This is making more sense.
What عدي wrote الأمر أصبح الأمر أكثر وضوحا
أو أصبح مفهوما.
This is making this is making more
أصبح مفهوما.
sense.
مفهوما. It's better.
Anyway, Nanji, you will have these. You will have this the script up.
Actually, this script is from a book that I have.
Okay.
If you're interested, it's from CCCS. They have a lot of
okay. From their scripts. Yes. Yeah. Okay.
I try to use different scripts because my scripts are with my style, and you have to be. It's like imagine it's just one doctor, so you have to have like different doctors. Even though I try to make it different sometimes, but it's always you at the end.
Exactly. Yeah.
Yeah. So let's stop finish the championship for today, and for the next week we are going to do memory retention. You already have some of the exercises on the site, but Monday and Tuesday we didn't have exercises, so I'm going to upload them for these the actual week for the memory retention. Okay.
Okay. Nanji, I actually did the memory exercises 3 and 4 between yesterday and today. Yep. And I was starting to do the heart attack. I don't think we could actually put in the Arabic in this one. Would you mind if you check that? Or maybe I missed it? Yeah.
Here is the glossary, and this is, wait, let me check.
Did I not scroll all the way down as usual?
It's right here. Click here to see it's so small, you can barely see it. So it's there.
I was looking I think I must have just been tired. Okay, so I'll just go back and do that. Yeah, fine.
Yeah, if you open here.
Okay.
Actually, somebody translated it.
Yeah, this is what I did today.
Okay.
This
is the one you were asking me for. Okay.
Today.
Okay, that's great.
And again, people go in and see what there is. There are.
By the way, Salma and Sira, you are doing a great job. But you shouldn't do all this by yourself.
Yeah,
so
I think you guys
divide the work.
Take initiative anytime. We do it because it's time. I just don't like to be lagging behind.
Catch up with it.
First 2 weeks, Sira and I, to make sure everything is filled in. But
we can't see anything blank.
Yeah. I'm doing that, and it is very overwhelming.
Yeah. Yep. So here I used the letters that you can see. And here we have the Arabic. Oh, that's the
Spanish one.
That's another glossary, common medical instruments. It's not translated yet. I'm not putting pressure on you. This is just as much as you want. Okay. I'm just saying that this it's not translated, but it's okay if you don't do it. If you have time, you do it. Okay.
Okay.
I'll do the TB one tomorrow because it's late now. But so you can do another one. because I see that you're going back to the previous weeks.
Okay. You know, I'm going to tell you something about translation and interpreting. So, haven't you ever heard that there are many translators that cannot interpret? They are very good translating, but cannot interpret, because interpreting is not enough with being a translator. Like, you're translating the scripts, and that's great, but the best thing that you can do is the memory exercises, the consecutives, and the role play. That's the thing. Like, that's the best thing. Because sometimes you know how to say something, but in the moment you cannot like think about it. So that's what you want to do.
Actually, that is so me, Nanji. Yeah, I'm good at translation. Yeah, at translating documents, like when I see them. But with
Yeah,
interpreting, this is so like new to me. Yeah,
yeah,
but I'm trying. Yeah, not enough, but
yeah. So I hope like the next week we will have like a presentation of the memory club. And remember, the memory club, I'm going to create a membership. So you will have to pay for a new membership, but it's pretty much the same as the old one. Okay. Except with the memory club included. Okay.
is it monthly? Like,
I'm sorry?
does it last for 1 month, or is it
Yeah,
for several months?
per month. Yeah, it is per month.
Okay.
Okay. So is there anything else, girls? I hope you like the update. I'm so excited for
Yes,
this
we
update.
love it. I love it.
Yes.
I love the updates.
Very
Thank you
nice.
so much, Nanji. This is
Yeah.
exactly what we need.
That's a
Brilliant.
Yeah, I know
huge work.
Salma told me at
Salma,
the
good upgrade. But that's very true.
yeah, it's an upgrade. And also, Salma told me at the very beginning, like, oh, could you please create something to track? And I was like, yeah, but I have to find something. And I like finally found it.
Thank
Nice,
you.
nice job. Wow, impressive.
Yeah.
Yeah, that's great. So we will.
So now we even have more things to do.
Yeah.
It's just this. It's the exact same. The only difference is just you can mark as complete, and it's easy to track.
It's nice that it does it for you now. It's automatic. So that's
It's
brilliant.
automatic. Exactly. For
Sometimes
example,
I forget to go back out and put a cross, and I'm like, oh, I don't
yeah,
even remember what I did because it does it by the name, and I'm not. So
yeah, I know. Okay. So I have to buy groceries now. So it was nice having you today.
Thank you all.
thank you so much.
Thank you very much.
Thanks,
See you.
everyone.
Yeah.
I'm glad I joined, really, even though I didn't participate.
Yes. So
Yeah.
next week, memory retention. So get your brains ready.
We will.
Yeah.
Okay.
Thank you.
Yeah. See you next week.
Bye.
See you.
Bye.
Bye.
Bye, everyone. Bye.
Bye. Bye. Take care.
Take care.